In this sketch, we're featuring the Flaviviridae family of viruses. Fittingly, we've set the scene in the Five Flavors Forest Cafe. Get ready for a bit of nostalgia, served up in a flavorful explosion of food, fun, and flaviviruses. Flaviviridae includes viral species in the genera Flavivirus and Hepicivirus. You'll notice our color concept for the cafe is based on warm hues, which means we're covering RNA viruses. Specifically, these are positive sense RNA viruses, as depicted by the beaming sunshine. What better way to symbolize flavors than with ice cream? Notice our ice cream artist's uniform? His hoodie should remind you that Flaviviridae are enveloped viruses. Now, the Flaviviridae family is made up of several viruses, most of which we will cover in this video. However, one member of the Flaviviridae family is special enough to get its own genus, i.e. Hepicivirus, and its own set of lessons. Yep, you guessed it, hepatitis C virus. However, to remind you that Hep C is a member of the family, we've made Sketchy's own Hep C Hippo the mascot of our cafe. Yum! Also notice that our hippo's sipping a milkshake from a single straw to remind you that these viruses contain a single segment of RNA, or in other words, they are non-segmented RNA viruses. The majority of Flaviviridae are arboviruses, short for arthropod-borne viruses. This means they are transmitted by insect vectors, like ticks and mosquitoes, during a blood meal. We're talking viruses which cause dengue fever, yellow fever, West Nile fever, St. Louis encephalitis, Zika virus disease, and a number of tick-borne viral hemorrhagic fevers. Again, as you probably guessed, Hep C virus is the odd one out. Definitely not an arbovirus, but don't worry, we'll get into transmission and a whole host of things in the subsequent HCV lessons. Okay, grab a spoon and get ready to try all the flavors of the flaviviruses. The first virus will be represented by this huge dinghy of ice cream. This stands for dengue fever, or you can be cool and call it dinghy fever, like the ice cream boat. And our ice cream boasts that it's 40% flavor-packed, to remind you that this flavivirus poses a threat to billions. About 40% of the world's population, with outbreaks in Asia, Pacific Islands, Africa, the Middle East, and the Americas. And if you plan on traveling to any of these areas, you are at risk too. So, we told you that dengue is an arbovirus, but you'll need to know the specific vector. For the answer, check out the cafe's wall art, a sign for a perpetual 80s night plus an Egyptian pictograph. Put them together, yep, Aedes aegypti. These mosquitoes are definitely one to know because they also carry yellow fever virus, Zika virus, and chikungunya, a member of the Togaviridae family. We'll talk about yellow fever and Zika in a moment. So, what is dengue fever? Dengue virus infects the bone marrow. In fact, another name for dengue fever is break bone fever. With the term break bone, what do you think are some of the things that can happen when the virus messes with bone marrow? Well, platelet production falls, so patients can develop thrombocytopenia, hence the falling plates. And without enough platelets, the risk of significant bleeding climbs, represented by that pool of strawberry syrup. In other words, dengue fever is a type of viral hemorrhagic fever, much like Ebola, Marburg, and yellow fever, which we'll get to in a moment. You may also notice our topping of crushed kidney cashews. This is to help you remember that renal failure is one of the more serious complications of dengue fever. Eventually, dengue can lead to septic shock and death. Our best approach to dengue fever is prevention. And the good news is that we can employ simple measures to prevent dengue fever by doing all of the smart things to avoid mosquito bites in the first place, i.e. repellent, clothing, staying inside, burning them with fire, and bed netting, hence the beard net. There is also a tetravalent live attenuated dengue vaccine available, but with one major caveat. It must be given only to patients with a confirmed prior dengue infection, because it can cause a deadly infection in those who have never been exposed to the virus. Let's move on to the next flavivirus, yellow fever virus. You'll notice we got a yellow South American water buffalo here to represent the yellow fever virus. This virus is transmitted by the same vector as dengue. Remember which mosquito? Yep, the Aedes aegypti. Co-infection from a single bite is possible. Take a look at this sign here to learn about the natural habitat of our buffalo. Much like our buffalo, the yellow fever virus is present in sub-Saharan Africa and tropical South and Central America. And, as you would have guessed, travelers to these areas are at risk of contracting yellow fever virus, especially during the rainy seasons. As you may have deduced from the fact that it is yellow fever, this virus causes jaundice. To make this connection extra memorable, we put a liver-shaped mud spot on the buffalo. Aside from jaundice, yellow fever also causes backache, which is represented by the exaggerated hump on the buffalo's back. Now, look at what our buffalo's sitting on. A red stool. Look familiar? Think back to our other sketchy lessons. It's a red stool to represent bloody stool or bloody diarrhea. And actually, in the case of yellow fever, you can also have bloody vomiting. Other signs of disordered bleeding include epistaxis, gingival bleeding, petechiae, and ecchymosis. You may also see low platelet counts and abnormal coagulation studies. As with dengue, prevent mosquito bites and you'll prevent the disease. But good news, there is a live attenuated vaccine available for travelers, represented by the syringe-shaped horns. You can remember it's a live vaccine since the buffalo is lively and animated and super cute. Now, let's move on to another important flavivirus, West Nile virus. The Nile-dwelling bird you see here should remind you that birds are the reservoir for West Nile virus. And the mosquitoes you see swarming about this AC unit should remind you of the mosquito vector. This mosquito species is different from the species for dengue and yellow fever, so we've added the brand Cool X to the AC unit to remind you of the Culex mosquito species. West Nile virus is a big problem in the US, and it's the #1 cause of mosquito-borne illness. Most cases occur during summer and fall when those pesky mosquitoes are out. Now, most people who get an infected bite wouldn't even know it because most cases of West Nile virus disease are totally asymptomatic. About 20% of people, though, will experience fever, nausea, and body aches. But take a look at these red feathers the birds have on their heads. This is because in rare cases, the virus can cause neuroinvasive disease, including encephalitis. Other neurological manifestations include viral meningitis, seizures, movement disorders that mimic Parkinson's disease, and even an acute flaccid paralysis that mimics polio. Eventually, the infection can lead to coma, represented by this bird here, passed out and floating down the river. If you perform PCR and serology on a sample of the CSF, you can make a definitive diagnosis, but no specific antivirals are available, and treatment is supportive. Okay, so let's talk about another important member of the flaviviridi, the Zika virus, represented by this forest zebra here. Zika virus is a lot like the other flaviviruses. It's an arbovirus that is transmitted by, you guessed it, the Aedes mosquito. Note here to not take your zebra to the self-checkout lane at the supermarket. Every zebra is basically its own barcode and you have no idea what you'll purchase. Now, Zika was one of those zebra diseases and probably the wrong choice on the exam. You probably wouldn't even have worried about memorizing this virus, except back in 2016, there was a major emergence of Zika, including cases reported in the continental US, i.e. Florida and Texas, which sent a wave of panic and a mad rush on the mosquito spray. Though, with that said, there are a couple important reasons why we in the medical community sounded the alarm. First reason, pregnant people. Pregnant people who contract Zika can actually spread the infection to their growing baby. That's because this virus can cross the placenta. Not only that, but uninfected pregnant people can become infected through sex and still pass the virus to the baby. No mosquito bite necessary. Unfortunately, vertical transmission causes serious birth defects, a so-called congenital Zika syndrome. with a major characteristic being microcephaly, hence the baby zebra doll. Babies may not only have apparently small heads, but may also have deficient brain tissue and neurological dysfunction. This syndrome is devastating, so it's very important to monitor pregnant people suspected to be infected with Zika and their newborns. As for the second reason to panic, Zika is usually a pretty benign disease, fever, rash, conjunctivitis, but it can cause Guillain-Barré syndrome, which may lead to hospitalization and possibly death. So yeah, it's a fair reason to panic. One final flavor twist on the flavivirus. So far, we've talked about mosquito-borne arboviruses. Well, flaviviruses can also be transmitted by ticks. There's quite a few species that we're not going to make you memorize, but just know that these viruses cause encephalitis and hemorrhagic fevers, which we'll represent with this ominous bloody tick farm. We don't know who or what kind of person would want to raise a blood-sucking tick farm, but to each their own. And that's it for the Flaviviridi family. The flaviviruses, that is. Hop on over to our Hepatitis C series to see what that other side of the family tree is all about. We're sensing there's an epic story there.